We need to talk about NHS resources. We do not do this enough. By resources, I mean all types, including staff's time, equipment, hospital beds, GP buildings, medications. Talking about these types of resources is really important because the way policymakers decide to allocate or not allocate resources affects the health outcomes we experience. My name is Madeleine Cochrane and I'm a health economist here at Bristol. As a health economist, I try to understand the relationships between resources and health outcomes. In my clinical trials research, I use two methods to collect evidence about resource use. I collect patient self-reported questionnaires where patients recall, for example, the number of appointments they've had in the last few months. Patient self-reported questionnaires are the most common way health economists in the UK collect resource use data. However, self-report questionnaires have their challenges, as patients can struggle to recall the details related to the care and medications they've received, especially if this care was many months or even years ago. An alternative method, which I also use in my research, is the use of patients' medical records. With patients' consent, I review their medical records to look at the relationship between their resource use and their health outcomes. Patients usually give me consent to review their medical records because they feel reassured about the fact that their name and other identifiable information is removed from their records before I'm allowed to access it. In recent years, there has been a lot of interest in increasing the role of medical records to provide evidence about how to improve the sustainability of the NHS and to improve people's health outcomes. Medical records are seen as having a lot of potential because they are recorded by healthcare staff, which suggests they are likely to be an accurate record of the type of care a patient received at the time. Medical records also means we have the potential to access data on people who may not typically take part in research and clinical trials, such as ethnic minorities, people with mental health problems, people with a lower socioeconomic background. However, a major challenge with using medical records is the lengthy legal and ethical processes required to access them. A lot of work is being done in this area at the moment, and I'm confident there will be progress made here in the near future. However, the second major challenge with using medical records is that we haven't fully investigated the quality of this data in terms of its accuracy, its completeness, and its reliability. And therefore, we don't actually fully understand the role medical records can have in helping us generate economic evidence. On the surface, we would expect the data to be accurate given it's initially recorded by healthcare staff, but when we think about how the data is input and subsequently processed, we recognise that there is so much more to consider than just who is recording the data. For example, in England, different hospitals and GPs use different IT systems and different software. And in addition, the introduction of new treatments, technology and processes means the data fields and data definitions used in medical records are continuously changing. I believe understanding the accuracy, the reliability, and the completeness of medical records is a really exciting area because we are experiencing a data revolution. The United Nations defines this data revolution as an explosion in the volume and production of data in society. Policymakers at all levels are demanding more data on what works, what is affordable, and what is cost effective. Currently, not enough economic evidence on resource use is being produced to meet their needs. I could use the prize fund to take my research further by bringing together different researchers who are interested in medical records and resource use to do a workshop to identify a research agenda for how we can increase the role of medical records to generate more economic evidence, which is reliable, complete, and accurate. Building up the economic evidence base is going to become even more important in future years as the pressures on the NHS are expected to increase over the coming decades as the demand for mental health, GP and hospital services are forecast to increase substantially.